I went to visit family in Tennessee. I saw people at a county fairground down there lined up waiting to get care that was being provided free by doctors and nurses who were volunteering their time. They were waiting in those lines to get care in barns and animal stalls. And I couldn't believe I was still in the United States. I knew immediately that what I was doing for a living was dishonest work. I was leading the corporate communications department for Cigna when I left. I was a person who was the main spokesman for the company. I handled financial communications and worked with their lobbyists to make sure that they had the talking points they needed to try to influence lawmakers. Part of what I used to do for a living was to help create propaganda campaigns to scare people away from Medicare for all, or a system like Canada has, or any other developed country for that matter, or even a public option. I was working to enhance shareholder value, to make sure that the company made money that Wall Street wanted it to make. And the consequences of that greed I was seeing right in front of me. The insurance industry likes the status quo because it largely built the system the way it wants it, and it makes a lot of money. And among those who make the most are the CEOs and other top executives. Just last year, the CEO of United Healthcare made more than $52 million. That was almost 400 times what the median average salary for United workers were. It's an enormous amount of money. Every other company in the industry has executives that are paid millions and millions of dollars. It is what they do for a living that is really most important for us to know, because they control our access to health care. They have set up the system to the way that enables them to make enormous profits, and their compensation is tied to how happy Wall Street is. And the happier Wall Street is, the more these guys get paid. These companies have been making more profits during this pandemic than any time in their history. In the US, we spend over $3.5 trillion a year on health care. On a per capita basis, that's more than $10,000, twice what it is in Canada and the average of other developed countries. And we spend that much not because that money goes to keeping us healthy or getting us well. It's because at least 30% of that goes to profits, to executive compensation, to administrative costs that are just simply not known in Canada and other parts of the world.
It's going to disappear. One day it's like a miracle, it will disappear. It'll go away at some point, it'll go away. Disappearing, it's going to disappear.
The Trump administration really set this country up to a certain extent. We already had the basic structure that was just ripe for failing us, but the Trump administration has made it even worse. In 2018, the Trump administration dismantled the pandemic response team. So we didn't have that structure in place to prepare for this pandemic. And also the Trump administration has been weakening the Affordable Care Act. More people are uninsured as a result of actions that the administration has taken, and a lot more people are underinsured.
Senator Sanders, where I come from in Canada, everybody gets the same health care and everybody pays the same for it.
I am talking to you now 50 miles away from the Canadian border. And as you have just indicated, somehow in Canada, for decades, they have managed to provide quality care to every man, woman, and child, and yet they spend 1/2 per capita as to what we spend on healthcare.
If we had Medicare for all, we would have universal coverage like every other developed country in the world. We had 30 million people before the pandemic who didn't have insurance. Now it's far more than that. Medicare for all would bring everyone into coverage, and it would also make sure that people not only have good coverage, but they wouldn't have to pay money out of their own pockets before that coverage would kick in. So they would have that protection. They would have cradle to grave coverage, and that's what we need in this country.
Let me just say this for the umpteenth time. What I am talking about, what Ali is talking about, is not radical. It exists all over the bloody world. What we are doing is radical. What we are saying is you don't have health insurance because you have a bad job. That is crazy stuff.